Suffering with knee pain? Hi, I'm Roz and I'm going to go through one of the more common issues that runners experience. There are 4 key steps to consider if you start to experience knee pain when running. Firstly, you need to identify where you're feeling the pain, and what's causing the knee pain in runners is often due to one of the following pathologies. Patellofemoral pain syndrome, which is generally felt as a dull ache around the kneecap. You commonly heard of this as runner's knee. IT band syndrome, which is felt as pain on the outer part of the knee. Tendinitis, which is felt as pain below the kneecap. Or meniscus or ligament injury, which generally feels deeper inside the knee or to the side of the knee. Next, you need to stop and assess. Ideally, reduce or stop running temporarily if the pain is more than mild discomfort. If your pain goes above 4 out of 10. Don't push through pain as it can worsen the injury. If this is the case, follow the police approach. The injury management, this involves P for protection around the knee joint to avoid further strain or impact. OL, optimal loading, is when you strengthen muscles that may have become weak or improve the length, muscles and flexibility of joints that have become tight. Balance work, like cardio work, are beneficial in this stage. I is ice, and that can be applied to reduce swelling and provide pain relief. C, to compress the area if there's significant amount of swelling using a compression wrap. And E for elevation is important to reduce any significant swelling. Step 3, if your symptoms are more mild with a pain score below 4 out of 10, then you won't need to use all those techniques, but you may need to modify your training to ensure that your symptoms can improve and fully resolve whilst continuing to train. This might be reducing the miles you run in a single session or over a weekly period, or substituting in a cross-training session such as a bike ride or a swim to reduce the loading on the knee. Step 4 is to identify why you have the knee pain. Are your feet overpronated? Do your trainers give you the right support that your own foot biomechanics? How hilly have your recent runs been? Are your muscles strong enough to take the increase in running training? How quickly did you introduce changes into your training plan? Overall, when managing knee pain, a key message is listen to your body. Mild soreness is okay, intense pain or sharp pain is not. So my last piece of advice is when to see a professional. If the pain persists after 1 to 2 weeks, or rest or modified training and rehab, if the swelling doesn't go down, or you experience locking or instability in the knee, or if the pain starts to affect your daily activities rather than just running. If you have any concerns with injuries, we will be at the Marwell 10K, so please do come and see one of our team, and we'll be more than happy to give you some advice and help to keep you running. Have a great race.